Welcome back to the Pulse Check. I'm Ryan Sabbatini, founder of PulsePoint AI, and your host for conversations that actually get into the real stuff happening inside healthcare. Today, we're diving into one of the most talked about and honestly most misunderstood topics in healthcare right now, GLP-1s and what it actually takes to make weight loss stick. My guest today, Paul Elsass, Vice President of Business Development at Embla. Paul has spent over 20 years in health and wellness, everything from running medically integrated fitness centers for rural hospital systems to building partnerships at some of the most innovative digital health startups in the country. He joined Embla about a year and a half ago to lead their expansion in the U.S. market, and what drew him in was something pretty remarkable. Their data showed that 80% of members who completed Embla's program were not regaining the weight after coming off GLP-1s at a time when everything else in the story was completely opposite. Embla is a fully managed weight care benefit built for self-funded employers. What makes them different is their philosophy. They use the lowest effective dose of GLP-1 medication, pair it with intensive one-on-one behavioral coaching, and the goal from day one is to eventually get people off the drug entirely and keep the weight off for good. They've got the largest real-world GLP-1 study ever conducted behind them, and now bringing that science from Europe to the U.S. employer market. Paul, welcome to the show. Really glad to have you here.
Thanks, Ryan. Appreciate you. Glad to be here.
So you've worked inside large hospital systems and you've been through 6 or 7 healthcare startups over 15 years. That's a pretty massive range of operating environments. I'm a little curious, how is your thinking about what good looks like in the healthcare delivery, and how has that evolved across your experiences?
Yeah, it's funny. It's been a long, long road and seen a lot of crazy things. But I think about my background's exercise physiology originally, and I think about my college days and the way that we looked at obesity, and we knew even then, a long time ago, it was a problem that was not being really addressed well. And I think we all push the natural lose weight by eating right, exercise more, and people would have some success here, some success stories once in a while, but for the most part, people really struggle with their weight. It just was just too slow, very difficult to get behavior change. And as you can see, we just didn't fix much. And so the weird part is that in the healthcare world, we sort of moved on, especially in the startup space. We started saying, well, now let's have a point solution for heart disease. Let's have one for hypertension. Let's have one for diabetes, SK. And it's like, but they're all kind of connected to the one we never really fixed. And so it's weird when you talk with employers and consultants, they say, wait, why are we still talking about this? Because it just never was fixed, and it needs to be fixed, because then all these other things we're chasing aren't going to be as big of a deal. So I think that's the challenge, and that's what we're trying to do. But I think the drugs are exciting, but they're also being used the wrong way. And ultimately it's not gonna bring the sustainable results that we want.
Wow, that's amazing. So it sounds like major sustainable change is really about getting to the root cause. And it sounds like over time, people are forgetting about the root cause. And this is where you're getting it right in the weight loss area.
Yeah. Funny, the insert itself on the medication says to be combined with lifestyle and behavior change. So I look at it as it's no different than if I went to pick up a prescription and the doctor put on the prescription, take this in the morning with food. And then I said, nah, I'm just going to take it at night with no food. I mean, it doesn't make any sense. And so I think we have to be more serious about, if you're going to do this, it can be a real miracle for a lot of people, but you have to follow the directions, and we have to do lifestyle and behavior change. And we need to make that the star of the movie and make the drugs the sidekick. Right now, it's the complete opposite.
Yeah, that's a really good point. Following what the experts are saying rather than just doing whatever feels good in the moment or whatever you're feeling like you want to do that day. You really got to stick to the regimen and what's recommended. So let's get into a little bit about what the core of what Embla is doing, because there's a lot of noise in that space right now. And the GLP-1 space is very crowded. You mentioned to me when you were talking before of Embla having a peer-reviewed paper, the largest real-world GLP-1 study to date, about 2,500 people showing 17% weight loss at roughly 1/3 the standard dose of medication. And then after, 80% of those members not regaining weight when the medication was discontinued. That's pretty incredible, especially the last one. How do you get to 80% non-regain when the industry standard is basically the opposite?
Yeah. So I think what we do, our original, one of our founders, Nicholas Seiler, he's a doctor. He actually worked at Novo Nordisk and he was head of innovation over Ozempic. He saw the way the drugs would be commercialized and he said, I'm not going to be part of this because it's going to be just a function of sell as many drugs, don't care about the lifestyle behavior change, and use the maximum medication. Because in Europe, you pay more the more that you use. And so that trend moved around the world and became this sort of standard of care. And we said, hey, we're going to go back to the really intensive coaching, but also we need to reestablish what that looks like, because we've tried hey, let's calorie count. Let's talk about motion and movement and activity. And let's talk about ketogenic diets and all kinds of things, right? And I think that's not really new to most of these people. They've heard that, they've tried it, and they've not really had much success. We figured we've got to look at the root cause for the behavior. It's a lot more complicated than what people think. I don't know about you, but having been a person, I never really struggled with my weight. So when I was in my 20s, I used to think, hey, it is just exercise more and eat less, right? It's simple. But then you start to meet folks and hear stories and you go, there's thyroid issues, genetic issues, there where you live, what kind of foods you have access to, addiction, there's emotional eating, there's mental health components to it. And so we decided we got to really use cognitive behavioral therapy, acceptance and commitment therapy, and really get to the real deep root cause of why does this person struggle so much. And then in addition, we need to make sure they understand from day one that that's the stuff that's going to give you the permanent results. The drug is just meant to help. It's meant to turn what they call the hunger voice, right? It's loud. Some people, it's very loud, right? So it's meant to mute the voice. But no, it's not meant to shut the voice off. And that's a mistake most people are making, is they go, if I shut the voice off, I'll lose weight because I'm not eating. Yeah, but that voice is something you'll always live with. We all live with that voice, and you have to naturally know how to deal with it. It's just a whole setup from the very beginning is complete opposite, so that they understand eventually from day one, that we're going to take you off the drug. And you don't need to be frightened of that, because we're going to teach you everything along the way so you can sustain it. And I think it was all that combined. And then the last was, we found when we were doing the coaching, we found that we didn't need much medication. People were losing weight. We didn't have to keep increasing the dose. Most people, just because they're not doing anything else, they just keep increasing medication because it seems like I'm plateauing, right? So I'll take more. And what that did was, a lot of people, when they start the medication and they follow the normal protocol, they'll get to a point where they can't stand the GI issues, right? So early on, it's been 2 or 3 months and they're having all kinds of gut issues and they can't stand it. So they quit. Well, that's a complete waste. And that's not necessary. It's an easy fixable, problem. 2, the ones that continue and are lucky enough to make it through the symptoms, they lose a ton of muscle, and especially at high doses. And no matter what you do, you're going to lose some muscle with these medications. But we've seen some data showing some of these people, 40% of the weight they're losing is muscle. And that is not a win. That's a complete disaster. And it's kind of, when we look at all the vendors out there, everybody's talking about percent weight loss as if it's just the weight loss is the same across the board, and it's not. We need to be focusing on fat weight. We need to be sparing bone. We need to be sparing muscle. So using the lowest effective dose is how you do that, right? And so that's the other massive thing that we really fixed. And all that came together, and lo and behold, like you said, we got to 6 months out after they'd been tapered off the drug for 6 months, and they had not regained the weight. They actually lost like another 1% during that time period. It's pretty phenomenal.
That's amazing. Yeah. So it's really about changing the mindset and empowering people to feel as though they actually do have some control. It's not just left in the hands of the medication.
Exactly.
So I want to touch on another thing. One of the things that you said in our prep call that I wrote down immediately was that, and you've already touched on this a little bit, but you said we teach our members from day one that the medicine's not the hero, you're the hero.
Yeah.
I want to pull that apart a little bit more, because it sounds like a motivational line, but I suspect from what you've told me so far that it's very intentional in the program and there's design behind it.
Yeah.
What does that actually look like week by week for a member? How do you build that belief before you start about de-prescribing the medication?
Yeah, I think that's the other important component, is having a face-to-face with the same coach that cares about you, that works with you, that knows you. And we have AI behind it supporting the coach and the member so that the coach can really be prepared on that call. It's a deep, intensive, face-to-face 30-minute call where they're prepared. They know, like, what do we do next? What should we be talking about? What's all the data saying? Everything that they've done over the last couple of weeks. What have we learned? Where are they making progress? Where could they push a little bit harder? Being on that call prepared having all that information ready to go, and then talking about the wins, the things that have happened over the last couple of weeks that we need to celebrate, you should be proud of. And I think that's something that's we really had to work at. These people get very depressed. I mean, when you've lived with something in 50 years and never really been able to really have success with it, it gets very emotionally draining. And so we have to get them psyched up, be their cheerleader, right? This is great what you did. You did this, like, right? This isn't the, and to show them that the drug's just gonna give you a little extra, little help, but you're amazing. And I think working on the mental health side of it is super important. I think most things are just addressing the physical, and you just can't do that. It's a whole person, and there's certainly emotions and their psychological state have a big factor in whether they're going to be successful or not. And so I think that's really what it is having that coach really working with you. We have the AI is constantly looking at the information, and every day the AI will give you a little, pat on the back, say, hey, I see you're struggling here. How about this? Try this. I got some other tools for you and some other information for you. Would you like to talk to your coach again or your doctor? So it's really amazing how that's starting to help as well.
That's amazing. Yeah, I think that's a good point, especially when you're trying to create change anywhere in your life, is when you have a coach, developing that rapport, getting comfortable with it, celebrating the small wins so that you can start to feel empowered and feel like you have some level of control. That's amazing. How do you, as you start to move towards, deprescribing, you mentioned that maybe some of the members get a little bit anxious. How's that transition?
Yeah, so it's easier for the folks that start day one with us if they've never been on a GLP-1, and we really have that discussion from day one so that they're prepared. They're less likely to have anxiety. I think it's more when we get folks who've been on a GLP-1, maybe their employer. Embla is often used as a carve out. So the employer will say, hey, we're no longer going to cover GLP-1s for weight loss through the plan, but we have Embla. It may be that they cut off. So maybe they did have coverage, they cut it off. So we inherit people, right, who were already on a GLP-1. And so those folks are going to be, understandably, they're going to struggle with what we're trying to say and whether they believe it or not. And I think the proof is in the pudding. We just have to show them, like, we'll often have them folks say, for example, they might say, hey, I'm used to using my Fitness Pal and I count calories, and why aren't you doing that? Why aren't we counting calories? And we have to say, well, were you losing weight doing that? No. Okay. So trust us. We're going to do things that are different, and you may not understand at first, but just watch what happens. Just watch what happens. And over time you develop that trust. And then as we approach that tapering point, right, and it's a slow taper, we do it over 9 to 12 weeks, but we tell them that voice is going to come back. It's going to get louder, but I'm here for you. I'm going to talk you through, and the AI is going to help too, but we're going to help you and your doctor work through, like, what are some natural ways that you can actually suppress that voice? And a good example, a friend of mine, his wife loves rice, absolutely, right? And so, it's a lot of carbs, and, but what they came up with was cauliflower rice has almost 0 calories. And it's not the tastiest thing, but it's interesting because it mixes well with any kind of sauce, any kind of flavoring. So you can make it taste pretty good. But what they did was they cut the amount of rice in half in her meals, replaced the other half with cauliflower rice. And now she can eat this massive pile of food and there's almost no calories in it, right? And that voice gets, less loud. There's ways to do that. There's emotional or, meditative ways to do it. There's a lot of things, physical activity, water. There's a number of things you can do to suppress that voice naturally. And that's the key, is showing them, you got this, we're here for you. And we're going to help you with some tools to put in your, in your chest.
It's really cool. That's amazing. So I want to talk a little bit about the commercial side of things, because this is where I think the business challenge really gets a little bit interesting. You describe large employers basically using their benefits consultants as a shield, and that the big consulting firms are slow to move on anything new.
Yeah.
But now that you have, successfully entered the US market with outcomes that are mirroring your European study, including the large healthcare system with 13,000 employees, what does your upstream, strategy look? What has to be absolutely certain or true for large employers to say yes?
Yeah, I've worked with several startups now. I've seen, and just the way things have happened in the point solution space. There was a time, and I'm sure you saw it too, where I could go on LinkedIn. I would write people I didn't know, CEOs of companies. and I'd get responses. It was amazing. I was like a kid in a candy store. This is amazing. I don't even have to like go knock on a door. It's just, they're just talking to me, and I would get meetings, and so it was amazing. But as people started picking up on that tool and using it more, then it became, LinkedIn just got saturated, and to the point where now people post stuff that should be on Facebook and everything else. So there's so much noise there now that it's very hard now to get anyone to pay any attention to your messages there. I think you have to do a good job with your social posts, with your company posts, right? Really good content, videos, interesting stories, interesting studies, and really get people to have dialogue within your posts. And that's how you're going to make a warm connection potentially. But that opportunity to cold message people has gotten more and more difficult. And like you said, and we talked about, there was a time on consultant firms when brokers, for example, would know about all the benefits and take care of all the benefit discussions, right? But then the whole wellness space and healthcare space got so full of point solutions that no one could keep up with it. And just that way. So they hired these national health and productivity consultants whose focus is just to understand the point solution space. That's all they're doing, so that they can tell the brokers and consultants, here's how you differentiate Embla from everybody else. And that's necessary. And then of course, as we all started figuring out, okay, we'll all start going to those specialty teams and getting them to talk with us. They got really busy, and especially the big firms that work with the largest employers, they got like, well, we know our time is valuable too, and we can only talk to so many of you. So we're going to kind of hold you back. And then the employers were like, hey, I got 500 emails this week from point solutions. And so the brokers, consultants are like, well, don't take them back, pass them to us. We'll take them for you. So it becomes a problem, right? For us, in terms of how do we get our message out there? How do we get heard? Because we know we have an amazing product and it's working, and we have real data. So it's not like we're trying to sell them something they don't need, but it's just, there's so many solutions. So what we did intentionally when we started in 2025 was we said, look, let's go downstream to the smaller brokers, consultants, with some smaller groups, mid-sized employers where there's less competition. Everybody wants the large employers, right? And let's start there. And we were fortunate. I mean, we had some great consultants that worked with us, that gave us some introductions. Warm introductions work really well. And then we just had some random things happen with some of the firms, and the Hub and Alira and some others have been amazing for us. And so we got our first clients in 2025, and now we have data. And that was real. I knew that was critical. I knew that we weren't going to be able to talk with a Mercer, an Aon, a Willis until we had U.S. clients and until we had data. So now we have that. So now we start knocking on their doors to show them what we've done. And then I think the other thing is to just continue to build consultant partnerships. What I found, and I know you see it too, most the brokers and consultants are very reactive. They're not proactive because they're more concerned about keeping a contract sometimes than they are being innovative and pushing the envelope. And so even if you have someone that's a really great wellness expert at your firm, the producer may say, I don't want to do anything because I don't want to rock the boat. And so they can't get anything new with that customer. So I think that's your challenge you have to find, is you have to identify who are the innovative, who are the ones that are willing to be proactive and willing to push the envelope and try new things. That's the key to, I think, is learning that.
I think that's a good point you make about changing your approach to capture the attention of some of those larger companies, and understanding why it is that maybe they're hesitant or not as responsive could really help on your approach and how you get your message to them, because you have the data, you know that your product works, you know that it's cheaper. It's really just about getting in front of them and presenting them the information in the correct manner. So you mentioned that Embla is now launching its full cardiometabolic program, Embla Restore, right now.
Yeah.
The goal, as you described it to me, is to literally end up just deprescribing blood pressure meds, diabetes meds, dyslipidemia treatment. That's pretty big deal. What made it the right moment to expand into a market outside of just weight management? And what do you think that you have to do correctly or execute on to make that look successful in the next 12 months?
Yeah, I think it was actually just a natural progression, because obviously working with people who are obese or struggling, most of them, it's not uncommon that they have diabetes already, right? And dyslipidemia, hypertension, and things like that. So we were already running into these folks anyway, naturally. Our focus initially, though, was, hey, we're going to be kind of your GLP-1 weight loss sort of vendor, but we realized we need to like be able to address the other conditions that they have when we already have them in the room. And we need to like take the same mindset, the same logic that we use with weight management. We need to use it for all chronic conditions. Like, what is the root cause? What's going on here? Which ones should we start with? What's the priority here? Not just based on what the, health metrics would say is the most important thing, but also like where the person's ready to work. They may not be prepared to focus on some areas. So we realized we need to like get that working for all chronic conditions, and treat the whole person. And that's always been part of our motto, is we're going to treat the whole person. When we realized that hadn't happened next, we needed to be able to cover all these other conditions, heart disease and hypertension, dyslipidemia, and so on. Then because we've always been about lowest effective dose, we realized let's really look at that. Let's find out. It's not uncommon. It's actually quite common that we'll see doctors where the patient does lose weight with a GLP-1, but they don't change anything on their medications. And you're kind of going, well, have you checked to see their labs? I mean, this person may not need their diabetes medication anymore. And I mean, why would we not look to see if we could deprescribe and not keep giving them a medicine that's just not necessary? So that's kind of our motto. I think it's not, I think you got to be careful. I think there's companies out there that are actually incentivized in the design of their customer setup to deprescribe and get paid to deprescribe. And I think you got to be careful with that, because I don't want to take someone off their meds too early just because I want to get paid. So I think we've got to really watch that. And that is out there. We're seeing it with some of these other vendors. But I think we should, though, if we can be medication free, we should look to do that, because that's obviously the healthiest that a person could be.
Yeah, that's amazing. It's pretty eye opening. I think some people might be aware of some of these models where the reimbursement model seems a little bit odd, especially when it comes to our health. And so it can, at least to me, it seems pretty reassuring, especially with your program, that you guys are flipping that traditional model on its head, and, not getting reimbursed when coming off the medication, or not getting reimbursed more just from prescribing a higher dose. So I think that's a big deal, and it can earn trust as well.
Yeah, I think we certainly are open to performance guarantees and some things that we need to, if we're going to say we can use less medication and get 17% average weight loss and have 80% of these folks not regaining weight, we need to put there needs to be some skin in the game on that. So we totally understand that. But I think you just got to be, with your design of how you're paid, you just be careful that you don't set yourself up to potentially put someone in an unhealthy situation. But yeah, it's, as employers, I mean, I think they want a partner who says, hey, well, we're going to take some risk here too. So for example, with us, with our low dose protocol, we sell everything as one bundled price. So you pay one cost per person per month for everything: your doctor, your coach, your medicine, everything's included. And it's nice because the employer, it's transparent. They know exactly what they're paying to take care of that patient, including the medication and the care. And it's nice to be able to track that and not have it be like, hey, there's a claim over here and a claim over here, and I don't even know what I'm paying for the drug because the PBM won't tell me. I don't know what my rebate is. So that's very common. So now they know exactly what they're paying. It's a very fair, good, low cost price. Most of the time, in fact, every time when we were the employer, our total cost of care per month with the drug included is less than they're paying just for the drug alone. So it's like kind of a no-brainer. But for us, though, because we charge the same amount regardless of the dose, that means there's risk on us. If I have to take the person to a higher dose, which costs me more as a company, we have to carry that, because that's on us, because we said we could use less medication and still be effective.
That's, like I mentioned before, I think it's reassuring, at least from somebody looking from the outside in, putting that, you guys taking that upfront risk is a way to build trust. Essentially, shows your confidence that in your program, and you know that it works.
Yeah.
So you brought up something that I thought was pretty cool when we were talking before. I hadn't really thought this through, but you've been monitoring alcohol consumption in your members, and you're seeing a significant reduction, and you're watching the addiction therapy angle closely because of its potential.
Yeah.
I know it's still very early stage research, but if GLP-1s do demonstrate efficacy in addiction treatment, whether that's, alcohol or opioids or stimulants, how does that change the value proposition that you're going to with employers? And how do you think it changes the broader conversation around GLP-1s and what they're actually used for?
Yeah, it's, we think about our obesity rates in this country, and it's pretty out of control. Some states a lot worse than others, but when you think about addiction, it's just crazy. I mean, there's so many, we all have addictive personalities in some areas of, like, when you think about alcohol and drugs, gambling, sexual addictions, a lot of these things that you're like, that's just so many people. And to be able to turn someone's life around where they're just kind of wrecking their life with these addictive traits, and to be able to potentially give them something that finally helps them. Because I do think I think we're born, some people are born with more tendencies towards those things than others. And I'll never forget my stepsister, when she was in her 30s, she had a child. And within that same time, not long, a few years after that, she got addicted to meth. And she left her husband, left her child, small child, lived in the streets for years, and then ultimately died from a dirty needle. And that's just heartbreaking. It's just heartbreaking. You go, why wasn't there something that we could have done for this person? And there's obviously a lot of homeless people, a lot of things going on out there. So the idea that we can have a medication, not make it the hero again, but make it where we can help us work on addictive tendencies and true behavioral health ways to address the addiction and reverse it, but have the medication there to kind of help suppress that drug voice, right? A little bit, or our alcohol voice, because that's what it seems to do. Like you said, in our data, we're seeing it. People are just not drinking much, if any. And it's, I had one lady that actually said she was going to quit taking a GLP-1 because she missed drinking. That's, I don't know about that one. It's got incredible potential, but I think the whole thing with microdosing, because if you don't need to lose weight, then like, what's the right amount? And I think, again, that's having the Danish have worked with GLP-1s longer than anybody, because that's where they were discovered and patented. So I think continuing the research we do with the University of Copenhagen to find out, like, what's the right way to dose it? When do you go up? When do you go down? Do you come off? How do you come off? Is it lifelong? I think there's a lot we still have to learn early days, but it's super exciting.
That's very cool. So you mentioned the University of Copenhagen on research. You studying the downstream impact on family members, the idea that when a parent changes their relationship with food and medication, it likely has this like trickle down effect on the whole household.
Yeah.
That's looking at things through like a very different lens, essentially, especially when it comes to going to the employers and explaining your return on investment. What's the hypothesis that you guys are testing? And if it holds up, what does that mean for how employers design and communicate these benefits?
Yeah, I think when I look at the startup space, there have not been many solutions. There aren't many solutions that really address the entire family. Most of the time, it's the employer, their dependent, 18 and older. And when we look at things like obesity, we're trying to take a situation that's live that already happened, and we're trying to reverse it. But why would we not want to get to the generation before that where it hasn't happened yet, or it's early, and we could actually have a quick fix obesity in a way that's never been done by just getting to the earlier, even to the, addressing everybody of all ages. And so I think that's what we're looking at with our data at the university is like, when a parent's on a GLP-1, that's going to have some impact on how they eat and their patterns and everything. And so these children are going to get impacted one way or the other. And we want to understand, what is that? What does that look like? Is it causing the kids to lose weight and be in a healthy weight range? And if so, that's great. But then how do we support that? So I think we want to look at next year, can we have something that addresses the entire family, where maybe we do some coaching together as a family, and we have content and things that are fun to do as a family that foster the success that's just naturally trickling down from what the parents are doing.
That's really cool. It's like not only creating change with the head of the household, but kind of letting that disseminate amongst the whole household. That's pretty amazing. That's really cool.
Yeah.
So we're kind of getting close on time here. So we're coming up on our last question. You're in the middle of building something pretty big here at Embla. You've got US clients that are live, data that's continuously coming in, the Embla Restore that you mentioned prior in our conversation, and as well as the Bywater TPA partnership coming online. You're heading into what sounds to me like a pretty significant fundraise. If you fast forward maybe 8-12 months from now, what does the signal look like that tells you that this is working the way that you guys hoped? Not any type of like vanity metric, but like what are you guys actually watching or looking for?
I mean, again, because my background's exercise phys, my whole passion's always been about giving people their healthiest lives. Like that's just critical to me. And it actually is it makes me very sad. And I think our founders feel the same way, that our whole company really, but we just don't want to see these people going out there, taking a lot of medication, not doing anything, gaining the weight back, and on and off, yo-yo. Their body composition gets worse and worse and worse. They have more, musculoskeletal injuries, and they don't look good. I mean, they feel like I'm smaller, but you're not healthy. It's not what we want. And so, for me, like what's that signal? The signal is that I see more and more people having these discussions about do the proper, care, do it the right way, use the lowest effective dose. And Emblas should be hopefully, and plugged in, and many employers that want to do that with us. But either way, I just want to see that become, especially we're already seeing a trend for these drugs to be more used almost like as a lifestyle treatment and not necessarily a medication that's for conditions. And that may be a trend that continues. So I think we just need to be very careful that we always remember they are treatment, they are medication, and all medications have side effects. And even if they get better versions of them, it's still a treatment. And I don't think we should treat it lightly, like, oh, just take a little of this to, lose a pound or two before wedding. I think that's a dangerous place to go. So yeah, I think it's just more that we start to see an awakening and awareness that this idea that it's a drug that you have to take the rest of your life, that you'll probably regain the weight back. I think to see all that change and people start to accept that, no, you actually can be medication free after you get to your target weight, that would be great. Because right now, I think a lot of people are skeptical in the US, but it's because it's just not been done the right way.
Yeah, that's something that touches on, kind of rings a bell in my mind. Is I do think people are starting to get skeptical, especially in reference to the bone health and muscle loss. I have friends and family members who have had similar experiences. And so to be able to have the confidence in a program like Embla to kind of defy what has been the standard in this space, and to go into it with confidence and real results showing, that's pretty amazing. So yeah, Paul, this has been genuinely fun conversation for me.
Yeah.
I think what stands out to me is that Embla is doing something, pretty different in the industry, and it executes very well. You're treating the whole person with the lowest effective dose, and actually designing for a day when your members don't need you anymore. Exactly. That's a very different business model, as we mentioned, and a very different philosophy. So I really appreciate your openness, the specific data that you brought, and the personal context behind why this work matters to you and the rest of your team. I want to make sure that our audience knows how to find you. Yep. So where can people go to learn more about Embla?
Just our website is joinembla.com, and my emails are very easy to remember. It's just paul@joinembla.com. I love to talk with anybody, even if you just want to shop talk with me, consultants, brokers, happy to do it. Love to connect and meet more people and share like all these things we have on where we need to go in healthcare.
That's great. Thanks, Paul. Thank you, everybody, for listening. We'll see you next time on the Pulse Check.